Hello, welcome to my student support system. In today's class, we will discuss a practical topic, that is how to prepare health talk plans. This lecture is in English, and if you want to study in Hindi, just click on I button and you will get link of Hindi lecture, or you can directly visit to channel my student support system. What is health talk plan? Health education is a process of educating people about health to promote health and prevent illness. Health education is a planned activity and help to change the behavior of the public. The written plan prepared to provide health education is known as health talk plan. Preparing a health talk plan is very important for student nurses and used in every setting. Clinical skill postings such as community health nursing, child health nursing, medical surgical nursing, midwifery, etc. So in all the posting, students need to prepare health talk plans and give health education to the general public, patients and their relatives. In practical examination also, students need to prepare health talk plans. So in this lecture, I am going to explain the steps to prepare a good health talk plan. Before writing healthcare plan, you should select a topic, or you will be given a topic. Collect authentic information and knowledge about the topic in detail. You should give facts. Then start writing healthcare plan. On first front page, you will write health talk plan on and then topic. For example, if you are going to provide health talk on tuberculosis, then you will write health talk plan on tuberculosis. Your first page will look like this: health talk plan on tuberculosis. On second page, 3 points should be written. First point is identification data, second is main objective, and third is contributory objective. So how you will write? First you will write identification data, in which you should include name of the health talk provider in student nurse, topic, on which topic you are going to provide health education, then date, on which date you will give, then time, audience or group, which audience, the patient's relative in the ward or a group of mothers in the community health center, etc. You can select. AVAIDs used or you are going to use, then you write their name as a poster or charts or pamphlet, anything. And then supervisor, who is going to supervise you. Second, main objective, or in other words we can say that it journal objective. Main objective will be one. So main objective is based on your topic and written as: after this health talk or after the health talk, the group will be able to understand the and then topic in detail. For example, after the health talk, the group will be able to understand tuberculosis in detail. In this way you can write. Then third point, contributory objectives or specific objectives. Under this heading, we should write subheadings about the topic and start as to introduce. First of all, you will introduce to yourself, to introduce the health talk provider, to define the disease, to enlist anything like you can write to enlist uh, causative factors of the disease, to enlist clinical manifestations of the disease. So there may be many to enlist, and for explanations you can write to understand, and if you are going to ask some questions, then you can write to recall. The client, the group will be able to recall. Okay, in this way we can write contributory objectives. So all the subtopics are covered, including definition, clinical manifestations, uh, diagnostic investigations, treatment, preventive measures. All points should be covered, and we will write separate specific objectives. Then your second page will look like this: identification data, main objective 1 and specific objective many. Then from next page you should make the columns. Approximately 6 columns are made. Time is very important. For every specific objective you should give time, specify the time. Total health talk should not be more than 20 minutes. So 15 to 20 minutes are sufficient for a topic. Then you will manage your time. So here you will write time 1 minute for specific objective introduction. Then content you will write what you are going to speak. And then teaching learning activity. What is teaching learning activity? Here you can write what you are going to do, what is being happening there. For example, the teacher is explaining this topic to the audience and audience are listening carefully. So in this way you can write teaching learning activity which is going to happen there. Then AVAID used. What AVAID you will use there for this topic? And evaluation. Okay, under evaluation you can write what question you will ask to the audience to gather their attention and to evaluate whether they have heard to you. So in this way you will complete these columns. It may contain 2 pages, 3 pages, 4 pages depending upon the topic and specific objective, but keep in mind it should not be lengthy. It is just health talk. Okay, then you will write summary of your health talk. Under this heading you should write the summary of whole topic which you will tell to the group at the end. You will summarize. Summarization is very important for the group to conceptualize the whole topic. Next you will write conclusion. Under this heading you should write the conclusion of the whole topic about your health talk, including effect of the health talk. And then of course bibliography. Under this heading you should write the bibliography which includes name of the book which you have referred, name of the author or publisher, year of the publication, and page numbers. Now you are ready to provide health talk. Thank you students for watching this video. For such latest updates for videos and lectures, you can subscribe the channel, you can like Facebook page, and for making your notes, you can visit mynursingstudents.blogspot.com. You can follow me on Twitter, Instagram, and join Facebook group Nursing Notes. Thank you. Have a nice day.